we're not amplified in the room, just the mic is used for the broadcast. So if you're having trouble hearing, please feel free to move forward. I'll be sure to try to project the best I can. My name's Rory Baker. I'm with Bankers Life here in Traverse City. I am a retirement planner and a financial advisor. And one of the risks in retirement, of course, is our health. And so today we're going to talk a little bit about Medicare. I want to help educate you on what the parts of Medicare are and what your options are when you're in your annual enrollment period, which we're in right now from the 15th of October through December 7th. It's the only time of year you can make changes to Medicare. And so today's purpose and goals are just to help inform. Of course, for Medicare, we have the 4 parts, A, B, C, and D. We're going to also look at what your options are. And then, of course, at the end, we'll have time for your questions. Part A of Medicare is hospital coverage. Part B are your doctors. This is also diagnostics, testing, and labs. Part C is Medicare Advantage, and Part D is your prescription coverage. Medicare Part A, they say, is free. However, this is what your FICA taxes have paid all these years. There's not a premium for it as you go on to Medicare based on those taxes that you previously paid. It covers most inpatient hospitalization, skilled nursing, and it also covers hospice care. It's broken into different benefit periods. When you are hospitalized, of course, days 1 through 60, Medicare will pay all but $1,632, and that can happen up to 5 times a year. If you are in the hospital for more than 60 days, the benefit period 61 through 90, Medicare will pay all but $408 per day. So notice that we went from a deductible to a copay at day 61. If you continue to be in the hospital, Medicare will pay all but $816 per day, days 91 through 150. And then days beyond 150, Medicare itself covers nothing. For skilled nursing coverage, it does require a 3-day minimum hospital stay. And it covers for therapy and rehabilitation. And the reason I bring that up is sometimes people are confused about activities of daily life. It does not cover for those. That's being able to bathe yourself, mobility, get in and out of the bed or in and out of a chair, being able to go to the bathroom, cooking, feeding yourself, those types of things. That's custodial care, and Medicare does not cover that. For days 1 through 20, Medicare will pay 100% of the costs. Days 21 through 100, Medicare pays all but $204 a day. And then days 101 plus, Medicare pays nothing, and that is considered long-term care coverage. The national average of what Medicare is paying is 18 days of coverage. And so even though they cover days 1 through 20, Medicare will pay all the costs, it does have to be granted to you. Medicare Part B. I'm sure that all of you are aware that your Medicare Part B premium changes every year. And moving into 2024, this premium will be $174.70 per month. This is typically taken right out of your Social Security check. But if you are not claiming Social Security and you are on Medicare, then they send you a bill every quarter. You may be able to delay Part B if you have creditable coverage. That typically includes group coverage when you're working. And it does cover doctor and outpatient services. There is an annual deductible that Medicare charges of $240. And then, of course, participating doctors, Medicare will pay 80%. You're required to pay the other 20%. And then, of course, if there are non-participating doctors, there can be an excess charge of 15%. Medicare Part C. Now, this is Medicare Advantage. It is it lumps together your A and your B. Sometimes it will include D, and it works in place of it. You must still pay your Part B premium, however. You keep your red, white, and blue Medicare card, but you don't need to use it. You just use your Medicare Advantage card that the insurance company sends you. It often will provide additional benefits, dental, vision, hearing benefits. Silver sneakers is a very common one. It may include prescription coverage as well. Some plans do and some plans don't. The advantage of that is if, let's say, you receive VA benefits or tribal benefits, you may not need prescription drug coverage. So you could choose a plan without drug coverage. It offers lower premiums, but it does have higher copays. And claims are actually processed through the coverage provider, not through CMS or the Center for Medicare. Medicare Part D, remember, this is your prescriptions. The plans vary based on the medications you take. Every plan has a different drug formulary. And so it's important that you do an annual review to make sure that your prescriptions match your drug plan. The plans cost, they can be anywhere from $7 to $120, depending on what your prescriptions are. And that's just for the premium. Most plans require a copay as well as a deductible period. Prescriptions are broken down into tiers 1 through 5. Tiers are your lower cost drugs, your generics or preferred generics. And as you go up the tiers, the drugs become more expensive. Each tier will have a different copay. And some higher price plans will offer limited coverage in what we call the donut hole. This is a time where the insurance company won't provide as much coverage. You take on additional coverage until you reach what we call the catastrophic level. Then the drug company will pay all but 5%, which is what you would cover. Some particulars about Part D. Some prescriptions require physician approval prior to you getting them. And some prescriptions, especially pain medications, will have quantity limits. Different plans cover different prescriptions. We had just previously mentioned the drug formularies. They're different for each plan, and those change every year. Sign up for a Part D plan is voluntary. However, if you sign up late, if you don't have creditable coverage, you will be assessed a penalty whenever you do sign up for Part D. So there are people that sign up for the Part D, even though they're not taking prescriptions, to avoid that penalty later in life. The biggest gap left in Medicare, we alluded to this a little bit earlier, is long-term care coverage. The Wall Street Journal talks about it being the number one mistake people are making in their retirement. Remember, this is coverage for your activities of daily life or your ADLs. This is something Medicare does not cover. And unfortunately, it is the number one reason for bankruptcy in the US right now. Extended care, it is also called long-term care. There's no coverage in Medicare. Home health care provides some limited coverage. Assisting living facilities, Medicare provides no coverage. Adult daycare facilities, Medicare provides no coverage. Nursing home care or skilled care for the first 100 days. I'd mentioned the average pay period is 18 days for Medicare, and 5% of that care is actually skilled care. So if you want to make a distinction between custodial care and skilled care, 95% is custodial care, and that's the help with the ADLs that we were mentioning. So just briefly to go over what we had said, there was a lot of information there. Medicare covers Part A and Part B. You can get that through an employer group plan. You can supplement with a Medicare supplement plan, or you can use a Medicare Advantage plan. And we're going to go over that in just a little bit of detail here for you. You have choices. Medicare covers 80%. Medicare A, B, and D covers 80% of the cost. You're responsible for covering the other 20%. That 20% can be covered either through a supplement or through a Medicare Advantage plan. And those are different strategies that you have for you. In our question and answer session, we can get into that for you, okay? Part D, your employer group plan can cover that for you. That's the creditable coverage we were talking about. And Medicare Advantage plans with prescription coverage will cover that requirement for you as well. All right, so we went through an incredible amount very quickly. So I want to personalize this for you and ask some questions. Again, because we have people watching online, I'll repeat your questions just so that they can hear it. So I'll open up the room to any questions that you have. Yes, ma'am. Yes, the donut hole was the question. With your prescription plan, when you are on a prescription plan, You different plans may have a deductible, some may not, but when you reach to a certain level of what the cost of medications are, the coverage amount will change. And this is called being in the donut hole. The part that you pay will increase, your percentage that you pay will increase until you get to what we call the catastrophic level. At that catastrophic level, your responsibility or your portion will drop down to 5% of the drug cost, and the drug company will then take over from there. And so people that will fall into the donut hole are people with some very expensive prescriptions. These often will be inhalers for COPD or some specialty drugs like that. And when you're in that donut hole, you're required to pay more of a copay during that time. Does that help you? It's not excluded. There are no preconditions. I'm sorry. The question was if you have a pre-existing condition, is it excluded from Medicare? It's not excluded from Medicare, but they will not deny Medicare to you because of a pre-existing condition. Mm-hmm. Right. Yeah. In about month 5, you would be in the donut hole. A greater percentage. The catastrophic level is right around $7,000 as the total cost, not just your cost, but the cost of the drug, right? So what the insurance company is paying, what you're paying with your co-payments, when those equal that catastrophic level, then your portion drops down to the 5%. Mm-hmm. That is a fantastic question. Total. But the question was, is that per medication or total? And that is the total cost for all prescriptions for an individual, for that person. Yes. Yes, ma'am. Gotcha. The question was, when you have medications and you're going to be joining Medicare, how do you choose what drug plan really best fits your needs? And what one does is go on to medicare.gov and you search for Part D plans. And within that tool, you insert all of your prescriptions. And once you have inserted all your prescriptions, it will tell you the best plan for you based on premium, deductible, and total annual drug cost. And of course, it will look through all the plans and it will show you which plan is best for you. You will also put in your pharmacy or your pharmacies, and it will show you what the drug costs are at each pharmacy. Some pharmacies will be preferred in network, whereas others will just be in network, and the cost can change. And so you can use that tool to make sure that you're not paying as much for drugs. A lot of times, what I do during the annual enrollment period are my folks that are on a Part D. We have a phone call or a visit every year, and we go over what drugs have changed. Let's take a look at what the formularies are and find you the best plan. And an annual review is absolutely necessary for anyone who has a Part D drug plan. It would be um, it could be catastrophic if your expensive drug is no longer in the drug formulary and you didn't check. And then the next time you'd be able to take a look at it would be the next annual enrollment period. Yes, ma'am. Yes. The question is, when does the information for the drug formularies get released? That way you know what plan to choose. That happens in the fall as well. Before annual enrollment period, that each drug company will say, here are our drug formularies. and then you can get on Medicare.gov to go through and look at which one makes the most sense for you. You the question is, they're turning TC, or they're turning 65, and they're starting to research and want to start to look up prescriptions to get an idea of what the drug formulary would be. Let me ask, what month do you turn 65 next year? June, okay. And then April for you, both of you T65, just within a few months, T65 being turning 65. You could absolutely look now, because you would be using the drug formulary for 2024, and that information is out. So you could get on tonight to Medicare.gov if you wish, and start looking up what drug formulary makes the most sense for you. And this is assuming that you're going to choose a Medicare supplement with a Part D versus a Medicare Advantage. You'll need to sit with someone and go over what makes the most sense for you. Medicare is based on assets and income, and so that often has a factor in your strategy in what plan you're going to choose. Mm-hmm. Okay, so the question was, what are the levels for the donut hole? The approximate numbers are, the donut hole begins right at around $4,000, and then the catastrophic happens right at around $7,000, and of course that number changes every year. They flux a little bit each year. But those are the general numbers for someone to be thinking of. And yes, those are for an individual. The total cost. So what the insurance company is paying, and the co-pays. Absolutely. Good question on that Part D. Yes, sir. This is a great question, and one that comes up very often. The question is, what is the difference between a Medigap or a Medicare supplement? Those are synonymous, versus a Medicare Advantage. The way I like to illustrate this is, a Medicare supplement plan has a premium with it. And when you're turning 65, if you're a male, the cost is going to be approximately, every plan's a little bit different, but just approximately $130 a month for your plan. When you go see the doctor, though, if you choose something like a Plan G, there's other plans that you can choose. In Medicare's infinite wisdom, not only do we have parts A, B, C, and D, the Medigap plans are, A through F. So it can get a little confusing. But right now we're talking about Medicare Gap or Medicare supplement plans. Let's say a Plan G that doesn't have any copays or deductibles when you see the doctor. So you pay your $130 a month as a male turning 65, approximately. But when you see the doctor, no copays, no deductibles. With a Medicare Advantage plan, it's exactly opposite of that. The premiums are extremely low, many of them $0 a month. But when you see your doctor, or when you go into the hospital, there are deductibles that you have to pay. So you have to do a calculation of which of these plans makes the most sense. And a financial analysis will often help with that. How often you visit a doctor will help with that, or just your attitude about having peace of mind. When you have a Medicare supplement, you know that you're covered no matter what happens, right? With the Medicare Advantage plan, you can spend up to $5,000. Every plan's a little bit different, but it's right around $5,000 to $5,500 as the maximum out of pocket that you're going to pay in one year, right? So as you think about which plan is right for me, those are the things you start to balance. With a Medicare supplement, there's no dental or vision or hearing benefits. With the Medicare Advantage plan, they do have some benefits, and I'm not going to call those insurance, because they're not. They're just benefits. For example, in our zip code, there is a Medicare Advantage plan that gives you $2,000 towards a dental benefit. They put it on your card, you swipe it at the dentist, whatever procedure you have, it can pay copays and it can go towards any procedures you have, including restorative care. For vision, there's plans that are anywhere between $100 and $150 they give you for lenses and frames. For hearing, there are some that will give you a benefit that, depending on what level of listening aid that you need, they will have a copay of, say, $599. And so for those of you who have hearing aids and understand that they can cost upwards of $6,000 per ear, suddenly $599 per ear starts to sound like a pretty good deal. Now, of course, we're not going to make a decision based on one factor, but those are the factors that you have to start to balance of which plan makes sense for you. Yes, ma'am. It would be A, B, and D, or C, and the C wraps all those together. Mm-hmm. Of it's broken into whether you're single. I'm sorry. The question was, Medicare is based on income and assets. What are those break levels of where perhaps your Part B premium starts to cost more than the 174.70 that was on the slide? When you're making six-figure incomes, that is when the costs start to go up. Your Part B premium potentially will raise, and costs in that way will go. It will not change your copays or deductibles with your plan, with your insurance plan. It's Medicare, your Part B premiums that will start to increase because of that. Uh, yes, and that information is right on Medicare.gov as well. Or I sit down with folks and we go over what those levels are and do a financial analysis of what makes sense, and would be happy to give you a card afterwards to help you answer those questions. Absolutely. It's a great question. The question was, you can retain parts B and D, and those costs, do they come out of your Social Security? Yes, the Part B premium is taken directly from your Social Security check. Your Part D premium can be taken directly from your Social Security check, or they can bill it on monthly. That's up to you. Yes, sir. Or Aetna or whatever. Yeah. Okay. So the great question. The question was, this is again a Medicare supplement versus a Medicare Advantage strategy. And oh my goodness, I'm sorry, I lost your question. Could you repeat the last part of that for me, please? All right. Does it come out of your Social Security? Okay. Yeah. So Medicare supplement versus Medicare Advantage. Typically, the companies that you purchase those plans from will take that money directly from your bank account. That does not come from your Social Security. So Medicare, Medigap or Medicare supplement insurance, that's the covers the 20% that Medicare doesn't. That's a private insurer. They will set up an auto draft for you. Medicare Advantage, if you do have a premium, same thing, they would set up an auto draft for you. Well, actually, the Medicare Advantage premium can come out of your Social Security check. It can be set up that way. But most Medicare Advantage plans around here, there are some legacy plans that have a premium, but most of them are $0 premium at this point. Yes, ma'am. Okay. The question was, if one were to travel, whether it be domestically or internationally, how does this affect your coverage? Correct? Okay, great. So, yeah. Uh, well, the quick answer to that is it depends, right? When you're choosing a plan, certainly networks are a part of the discussion, right? Do we travel? And if we do, if we travel extensively, are we traveling domestically or internationally? Domestically, a Medicare supplement will travel with you no matter where you go. That doesn't mean a Medicare Advantage plan won't. Some Medicare Advantage plans have a network and some do not have a network. So as you travel, you may have to work within a network. Other ones, you may not have to worry about that network. So that's yet another one of those um, nuances that you have to really look through. In terms of international travel, they will cover you for emergencies, but emergencies only. Yes, ma'am. No silly questions here. The question was original Medicare is Part A, Part B, and Part D. Then you would supplement that with a Medicare supplement or a Medigap. Your A, B, and D covers 80% of your healthcare costs. That's what Medicare pays, is that 80%. So in order to cover the other 20%, you get your Medigap policy. Or you can get a Medicare Advantage plan. And that Medicare Advantage plan is your A, B, and D all wrapped together in what we call Part C. I actually simplified that just a little bit for the answer. It can get more complicated than that, but to answer your question, yes, original Medicare ABD plus MedSup, or Medicare Advantage, which wraps them all together, which is Part C. You're only choosing either Medigap or Medicare Advantage. You're not getting both. It's either or. So either you do original Medicare, Part A, Part B, Part D plus Medigap, or you do Medicare Advantage. Medicare Advantage then wraps the A, B, and D into the one plan. But I would like to note that whether you choose a Medicare supplement or whether you choose a Medicare Advantage, you're still paying your Part B premium no matter what. Yeah, the 174, you're paying your Part B premium. Yes, ma'am. If you're on original Medicare, your cost Part B premium would be the 174.70. You would have A, B, and D. You would have a premium for D. That's $7, $20, somewhere around there generally. And then you would have your premium for your Medigap policy. So all that together, if we're going to just use a round number to walk away with, it's not an exact number, but just a round number for you, is right around $300 is what you can budget for original Medicare when you're turning 65. That would cover your Part B premium, your Part D premium, and your Medicare supplement. Again, that's just a rough number, okay? Around $300. On a Medicare Advantage, you would be paying your Part B premium. You would not pay a Part D premium because that's wrapped into your plan, and you would have a very low monthly premium, if not zero. And so your monthly cost would be the 174, but you would then be paying deductibles and copays when you visit your doctors. So as you can see, as we start to parse this out, if you are a person that wants to know exactly every month what you're going to pay and you want to budget it, your Medicare supplement is going to be a better choice for you because you know what every month it's going to be and exactly what your health care is going to be. If you get a Medicare Advantage, You're not for sure what you're going to pay per month because it would depend on how many times you go to a doctor. If you were hospitalized, if you were not, did you get an MRI? Did you not? Right? Did we have a cataract surgery or did we have a knee replaced or whatever the case may be? Right? Each of those procedures, there is a cost to it. And so if budgeting for you on a monthly scale is important, that would be a consideration for you. I often look at it on an annualized basis whenever I'm doing my financial analysis of it. What is our Medicare supplement cost, right? And what is that on an annualized basis versus how much did we spend in healthcare on an annualized basis? And that can help us also show which plan makes the most sense. And the reason I say that is in the state of Michigan, whenever we turn 65, and let's say we go with a Medicare supplement, the price for a male turning 65 is going to be approximately $130, for a female about $117. But every year that cost goes up somewhere between 2 and 10%, because as we age, we use more health care. Therefore, the price of that goes up. Whereas in a state like Florida, if you were to turn 65 and you're going to go on to a Medicare supplement, they charge you one price for the rest of your life, but it's far, far higher than what we're being charged here as someone turning 65. So the price doesn't change, but you're paying a more expensive price the whole time. So the way Michigan views it is that a 65-year-old is not needing as much health care as, say, an 80-year-old. And that change in premium climbs a little bit each year. So as you can see, when you're 65, and let's say it's a male turning 65 and approximately $130, when you're 80, that price has climbed. And so now we need to redo the calculus on that, right? What's our annualized supplement plus Part B? If that starts to look at $5,000 plus, there might be some other options for you. And a Medicare Advantage plan, if it has a maximum out of pocket that's similar to what you're already paying in premiums, there may be some reasons that you might want to switch over. I'm not going to go yay or nay on either of those plans because they have different strategies and they have different reasons for choosing each one. When we meet individually, we could go over that in a little bit more detail, but in this forum, I'm not going to favor one or the other. I just want to make sure you're understanding the difference between the two. Yes, let's go to the back of the room. Gotcha. Okay, so the question was for your prescriptions, whether it's a Part D prescription plan or whether it's a Medicare Advantage plan, how do the tiers work? So there are tiers 1 through 5. The drug companies come up with their formulary and they say your blood pressure, it's a generic, it's going to be a tier 2, right? Or it'll be a tier 1. 1 and 2 are your generics. Tier 3 is something that's not a generic, right? And then, of course, tier 4 is going to be even more specialized. Tier 5 will even be more specialized, right? So if we're on a tier 1 or tier 2 drug, let's say we're taking atorvastatin because we have a cholesterol problem. That's a generic drug. That's a tier 1 or a tier 2 drug. If we are taking something that is more specialized, that is where you're going to start finding the tier 3, the tier 4, and the tier 5. The way they differ is tier 1 and 2 have a copay, and that amount is either zero or a few dollars, depending on each plan's a little bit different. If you have a tier 3, that copay is going to be somewhere around $25, right? Tier 4, it goes up, and then tier 5, it goes up again. And so each tier is more expensive, including the cost of the drug as well as the copay for the drug. Good question. Mm-hmm. The question was, if you're in the middle of the year and your doctor decides to change a drug or add a drug that happens to be a tier 3, 4, or 5, is there anything that we can do to help bring down the cost? Correct. There are formulary exceptions that you can request. rather than using the brand name drug, could we use a generic instead? Right? Because once you're in your drug formulary, once you have your drug formulary picked for the year, and if your doctor prescribes something outside that formulary, you can request a formulary exception so that it will be covered within your drug plan. That will help you bring down the cost. In addition to the formulary exception, you can also appeal to have the insurance company do a tier exception. So bringing it from a tier 4 to a tier 3, or from a tier 3 to a tier 2. Excuse me. These are forms that you fill out with your doctor and send to the insurance company for them to make a decision on that. There's also help through state programs for prescription costs, as well as manufacturer help. And I have a lot of clients who are on tier 4 and 5 drugs. They need help with it, and they get help through the manufacturer. Almost every website of a drug manufacturer will have a link how to get help, paying for your prescriptions. What's tricky about it is some drugs will require you to have a Part D in order to get the help, and other drugs don't want you to have a Part D in order to get the help. So it gets even more nuanced as we go along, but that's when you should be meeting with someone who does Medicare and is licensed in order to help you through those processes. Great questions tonight. Mm-hmm. Well, at that point, that's when you would ask for a formulary exception so that it could be included within your formulary. Like if it's June and suddenly this new drug is out, it will be included in some drug formularies, and every insurance company will have a tier for it. And so we would have that information. We would just need to know, if there's no generic for it yet because it's a brand new drug, then either manufacturer help or help through the state, or, or pay for the drug. I mean, if it's a brand new drug that's brought out in the case that you said and there's no generic for it, that's a little bit harder to deal with. It has not been difficult. It takes persistence and good conversations with your doctor. The doctor has to fill out the formulary exception, and it will be, we have tried the generics and they're just not working. He absolutely has to have this drug. And then they send it in, and you get a 1-year exception for that. Then during AEP, the annual enrollment period, you go to medicare.gov, you type in your prescriptions, and you make sure that that drug is in there, and you find one where it's in the drug formulary for you. Mm-hmm. Okay. Mm-hmm. The question was, when we're talking about prescriptions, whether it be a brand new drug to the market or any other drug, when I say insurance company, who is it that I'm referring to? It would be whoever the provider is that you choose on medicare.gov. That could be Aetna, that could be WellCare, that could be a number of the private drug companies that create these formularies each year. There's some 26 of them to choose from, and every year they change. And so it is not uncommon for people to switch drug plans on an annual basis to make sure that their drugs are in the formulary in order that they need. That's why it is so important that you sit down with a licensed professional and go over what your Part D is and make sure that you don't have any surprises going into the next year. Yes, the question was, could a wife and a husband or two different spouses have different plans? Almost decidedly so, because they're not taking the same prescriptions. That's not uncommon at all. One may be on Silver Script and the other one may be on another one, right? And so it's just, that is not uncommon at all. Great question. Yes, ma'am. Okay, so the question was in network versus out of network, and how do you choose which doctors are in and out of network, and what does that mean? Whenever you can have an HMO or a PPO. There's a number of these different types of plans. One of the ways that they reduce cost is by getting doctors to sign on and accept their insurance, and they create this network of doctors, right? Some networks require you to visit your primary care physician before seeing a specialist, and this is one of the ways they control costs. Other networks don't require you to see your primary care physician before seeing a specialist. You know, and so when when the doctors sign on to this network, all they're saying is that they're not going to treat you because you happen to have, I don't know, Aetna over Priority Health or whatever it may be. It's just that you would pay out of network costs when you see that other doctor, right? So your in network costs are going to be lower than your out of network costs. And so if you went to see a specialist that was not in network, but you needed to see that specialist, say a cardiologist, right? You got to get your heart looked at. That may be more expensive because that doctor is out of network. It doesn't mean that you won't get the care. It just means that care could be a little bit more expensive because it's considered out of network. So whenever you're looking at your plans, and the in network and out of network really only pertain to the Medicare Advantage plans. The Medicare supplement, there's not the network. As long as the doctor accepts Medicare, they accept the Medicare supplement. It doesn't matter what the provider is. It could be Washington National. It could be the Retired Preachers Association. It could be the Shriners Medicare supplement. There's a number of Medicare supplements out there, a number of them. They're all required to provide the exact same amount of care, right? So if I'm on a plan G, no matter if I am on, it doesn't matter which provider I'm on, that plan G will operate the same no matter where I am at. It gives the exact same coverage no matter where I'm at. If I'm on a plan D, it acts the same. If I'm on a plan F, no matter where I'm at, they work exactly the same. But when we are within a network, you can still get the same care, but if your doctor is out of network, you're going to pay out of network prices. Okay, so remember earlier we were talking about the parts of Medicare, A, B, C, and D. The Medicare supplements or the Medigaps are also letters, right? And so a plan D versus a plan G versus a plan F versus a plan N, they all have different coverage amounts. Some have copays and some do not. Some pay the excess fee that we looked at, some do not. And so you have to, in addition to saying, you know what, I think Medicare supplements for me, you then have to choose which plan makes the most sense for you. So again, I would not encourage you to try to figure this out on yourself. Sit down with someone in order to try to figure out what makes the most sense based on your situation. A plan D covers less than a plan G. A plan N covers very similar to plan G, but it has copays. So therefore the cost is a little bit lower, even though it covers the same thing. A plan F is an older plan. It's still that you can't get into a plan F now, but the plan F is still there for those who originally enrolled in it. It is a little bit different than the other ones that we had just talked about. There's nuances with all of them. If you're just starting out and you want to look at a supplement, I would steer you towards a plan G as the beginning point for you to start to look at. It's a very robust Medicare supplement, widely available, and covers a great deal. The only thing it does not cover is your Part B deductible, that $240. And so if you're on a Medicare supplement plan G, the maximum you're going to pay other than your premium is $240 annually, because it covers everything else. There's no copays, no deductibles. You pay your premium, right? But there's no copays, no deductibles, with the exception of that $240 annually. That's a really good place for you to start your research if you're looking at Medicare supplements. Yes, ma'am. Yes. The question was, we had talked earlier that there could potentially be penalties if you don't sign up for Part B or Part D whenever you become eligible, with the exception of having creditable coverage. And yes, if you don't sign up and if you don't have creditable coverage, then yes, there would be a fine for that. The question is, for a Medicare supplement, are there open enrollment periods for it? And yes, your supplement, typically you can start enrolling 6 months before you turn 65. For Medicare Advantage, it's 3 months before you turn 65 is that window. For a Medicare supplement, it's actually 6 months before, the month of, and 5 months afterwards. That is your window. With Medicare Advantage, it's 3 months before, the month of, 3 months after. Right. And so those two differ a little bit. And again, that's why we encourage you to sit down with someone, because of all of these great questions that you're asking. Okay. The question is, if you don't enroll in a Medicare supplement, um, part A of the question was, is there a penalty? And part B, if you decide to enroll in it at 66 or 67 down the road, can you still get into it? All right. So a couple of noteworthy things to talk about here. For a Medicare supplement, there is not a penalty if you don't enroll. It's not like Medicare Parts B and D. The Medicare supplement is private insurance that supplements, it's the gap, right? Fills the gap that Medicare doesn't. When you turn 65, that 615 window that we talked about, this is the only time in your life that you can qualify at a preferred rate and without any health checks for a Medicare supplement. It's when you enroll in Part B, it's when that window opens, right? So if you're going to stay on work coverage or group coverage for another 2 years, you don't enroll in Part B because you've got your group coverage. So you defer your Part B until you come off your group coverage, right? One, we don't want to pay the 174.70, right? And also have the group coverage. That would be silly and just a waste of money. So when we come off of our group coverage, that's when we're enrolling in Part B. That's when our window opens. So when that window opens, that's the only time that you can get into a Medicare supplement without health checks. So when you turn 65 or when you enroll in Part B, that window opens for you. Okay. So if you, let's say we turn 65, we have Parts A, B, and D, but we do not enroll in a Medicare supplement nor a Medicare Advantage plan. You're enrolled in everything that you are required to. It's just that you're going to pay 20% of the cost, right? So if we had a heart attack or we had something critical like that, you can imagine the cost being extremely high. No one's saying you have to enroll in the Medicare supplement or the Medicare Advantage. However, you are taking on the risk of that 20%. All right. When, if that's your decision, and people have done this, if at 66 you want to get a Medicare supplement, you would then have to health qualify for the supplement because you missed your open enrollment window. The question was, could you be turned down for a Medicare supplement if you have missed your open enrollment window? Yes, they can absolutely say no. Things that are, let's say, organ transplants, diabetes with insulin, of course, heart attack, stroke, COPD, things like that, they would absolutely disqualify you for. And so the only time the only time that there are no pre-existing conditions is when you're in your open enrollment period. So that's either when you're turning 65 or when you're coming off of your group coverage, which coincides with you enrolling in Part B. Okay, so okay. Yes, the question was that turning 65, staying on work insurance, spouse is also covered under the group plan, right? In February, we're going to retire, and group insurance at that point will then cease. So, yes, both you and your spouse will have an open enrollment period at that point, and you would enroll in Part B. Both of you would. And CMS has 2 forms that you would fill out for that. Your employer will fill part of that out for you as well. And then, yes, you would also make a decision at that point of Med Sup versus Medicare Advantage. There are some timelines that you and I should talk about to make sure that everything happens as it should. And why don't we just spend a few minutes after this presentation and we can exchange information, okay? That was a fantastic question. I love that you're listening and asking good questions. Anyone else have a question that's Medicare related? Well, excellent. Are there any other Zoom questions? Okay, well, fantastic. Folks, again, my name's Rory Baker with Banker's Life, just right down the road. I really appreciate you taking some time out of your evening to talk about this. It's important that we become educated, and appreciate it very much for you being here. Come up and visit me here in just a second. Let me give you my business card. We can exchange information and we can continue the conversation if you wish. What we talked about here tonight is the introductory level of what we're getting into, and want to make sure that you have the information you need to make good decisions. Okay. Thank you all.